in my professional life, I only ever meet patients who have a diagnosis of cancer and who are facing often a very significant or even a terminal prognosis. So I just wanted to spend a couple of moments in talking about some of the things that have happened, and I'm not sure how many of you are medics around the table, maybe not many, but there are really huge advances. So if you go in to have an operation now for a tumour, quite often now it'll be done by a robot. The surgeon won't actually be anywhere near the table where the operation is happening. He'll be sitting 3 yards away, 10 yards away, operating on a little console that looks a bit like a computer game. The outcome from those operations are really massively better than the operations that we used to do even 10, 15 years ago. But those things are not available to everybody, and they need to be made available. The job that David and I have trained to do, which is to use radiation and drug treatment to cure cancer, the sorts of technologies that we've been developing, and David's been a front runner in the development of one of those technologies, robotic radiotherapy with CyberKnife and what's called Sabre. Those things, again, are available in many centres around the country, but not in all of those centres. The availability of proton beam therapy is only in 2 centres in the UK, one of which is open, one will open next year. So there are potential inequalities for the availability of treatments. And most recently, the developments in immunotherapy, the use of new drugs that wake up the patient's own immune system to attack their cancer, are changing the landscape across a range of different tumours that previously we would regard as incurable, and which would inevitably have left people in a situation where they would die of their disease. We're now prolonging the ability to control the disease, and in some patients, diseases like melanoma, we're curing 50% of patients who would have died even 10 years ago. It's unbelievable, but those treatments are not available anywhere, and that's really the theme I want to spend the next moment or two dwelling on. It is an absolute tragedy when I meet patients who could have had access to these treatments, but unfortunately through lack of knowledge perhaps in the medical profession, dare I say it, sometimes a desire to not to admit that we don't know something ourselves as doctors and not referring on to other people, we find patients who are in a situation where it's very difficult for them to recover or to get over the illness. And I think that's really the first way in which, in fact, it's not quite the first way in which I met Rabbi Grunfeld, and I'll tell you about that in a moment, but it's the way in which I interact with Rabbi Grunfeld and the Mars organization is really through the role in advocacy, in telling patients about the possibilities that exist for them. I think it must be very difficult being a patient when you sit in front of a doctor and the doctor tells you, this is how it is. It's rather difficult to challenge a doctor, especially if you need to place your trust in that doctor because you're relying on them to get you better. To have somebody with massive knowledge, with the confidence and the tenacity, if I can call it that, to address questions to doctors, and when answers come back which are not satisfactory, not to nod and say, thank you very much, doctor, that's a wonderful opinion, to actually say, I'm not sure I agree with you there, I'd like to just question this. So I've been on the receiving end of that, and I think it is fantastic that there is that opportunity for patients to have somebody who will represent them, and somebody who actually has the willingness to put himself in those difficult conversations where he talks with the medical profession and he makes the connections. And Rabbi Grunfeld will message you, and you might be busy, so you don't get back to him, and he'll message you again, and he might send an email and then maybe a voicemail, because we now have one another's mobile phone numbers. But the message I'm making, and it's not to embarrass him, is that these are difficult things to do. To continually ask the same question is often difficult, but it is what patients need, and they need somebody who has that ability to do that and to be the representative of the patient. Now, it's not just that Rabbi Grunfeld and Mars are willing to ask those questions. they also ask those questions from a position of huge knowledge. And I've told Rabbi this in our meetings, that often the level of question that I get from him about some nuance to do with the disease or the treatment is far smarter than the questions I get from our trainees. And I'm sure that if you hadn't had a higher calling, if he hadn't had a higher calling, then maybe he would have chosen to be a doctor or a physician or a scientist. I don't know. But there's no question that when patients receive advocacy from Mars, my experience is that the questions are exactly what they should be. They're about the issues that are important, and they're asked in a way that is always polite and friendly, but needs an answer and demands an answer, and therefore gets an answer on behalf of the patient. So I think my abiding interest in this organisation and my willingness to give time to it and to support it is really because it's there for patient benefit. And irrespective of where someone lives or where someone comes from or what their background is, they should, across the world, in this country, in this city, they should always have access to the best medical advice and the best medical care. And because that's not always the case, we need organisations that will enable patients to receive that. And to my mind, the Mars organisation is exactly that. It fulfills exactly that function. And so I am honoured to be invited here to this wonderful gathering. I look forward to the rest of the brunch. And I'm also very pleased to see so many people around the table. And I'm very hopeful that the support, both philosophical and financial, that the Mars organisations need, I hope that that will be forthcoming to enable the team to carry on doing their invaluable work. So thank you for listening to me, and once again, thank you for welcoming me amongst you.